A vaccine shortage is crippling India. States say they will not be able to begin mass vaccinations for all adults from tomorrow as planned. India has recorded more than 390,000 new infections, but experts believe the real number could be up to 10 times higher.
India is the world's biggest vaccine producer, but it doesn't have enough stockpiles to inoculate its own citizens. From this weekend, all adults are eligible to receive a shot, but many states say they simply don't have the supplies to start. Mumbai has closed its vaccination centres for 3 days, while Delhi has urged people not to queue for any shots until vaccines arrive. The army has opened up its hospitals in a desperate bid to provide some relief. Battling to find hospital beds, people are flooding social media and messaging apps with pleas for oxygen and medication.
ये सब फेक है हम लोग सुबह से भी मिला रहे हैं कल से मिला रहे हैं फोन लेकिन कहीं नहीं बात हो रही हमने इधर सारी एजेंसियों में गैस के लिए मना कर लिया 2-3 घंटे खड़े हो रहे हैं लेकिन हमें कहीं से भी गैस ऑक्सीजन नहीं प्राप्त हो रही है.
The first batch of medical supplies from the US has arrived. It includes hundreds of oxygen cylinders, N95 masks, and nearly 1 million rapid testing kits. The US is also sending raw vaccine materials to help ramp up production. Experts expect India's medical oxygen supply crisis to ease by mid-May, with production increasing by 25%.
Rebecca Bundan joins us for more. Rebecca, the government has held its first high-level COVID meeting in months. Can we expect coordinated action?
So this was the first meeting of Narendra Modi with his Council of Ministers, the entire Council of Ministers, during this second wave. There have been other high-level meetings, of course, but this comes as there is mounting pressure on the Indian government to take swift action, given the depth of this crisis, with the number of deaths that are taking place, the rising numbers of infections, those oxygen shortages of hospital beds, medicine. And what was said at the meeting was that all the arms of the government are rapidly trying to address the situation. The government also said it was working with state authorities to try to ramp up hospital beds, the number of hospital beds, and increase oxygen production and transportation of oxygen, distribution of medicine. But many experts are saying that this really just isn't enough. They're saying now is the time for swift, decisive action to be taken. There are even a number of doctors that are calling for measures as extreme as taking another nationwide lockdown, because the depth of the crisis is such that they say that something really needs to be done that's just going to arrest the situation and try and at least have some hope of bringing it under control as this continues.
And is the vaccine program then actually going to begin this weekend?
Officially, India's vaccination drive is meant to open up to everybody over the age of 18 from tomorrow. However, the reality is on the ground that there aren't enough vaccines, and a lot of states are struggling. Even this weekend, from today onwards for the next 3 days, Mumbai has had to close its vaccination centres because there are no jabs. It's been an ongoing problem during this week. There are a lot of people turning up at the vaccination centres, including elderly people who just couldn't get access to their second dose because it just wasn't available. So this is really a big problem. There are other states that have said, including Karnataka, that they can't go ahead because of the same situation. And India is the world's largest producer of vaccines, and only about 2% of the population have been vaccinated so far, and this vaccination drive started in January, so this has been really much slower than expected. And what's worrying is that India does see its vaccination drive as its main way of battling its way through the pandemic. Even the Prime Minister, Narendra Modi, has been urging everybody to get vaccinated, but at the moment that's just simply not possible for a lot of people because the stocks aren't there.
And the Modi government is also under pressure to share more data about new cases.
That's absolutely right. So the Indian Council of Medical Research has a lot of data, a wealth of data on people that have been tested in India for the coronavirus. However, that data, the access is very, very restricted to certain people in the government. Now there are these medical researchers and scientists in India that are appealing to get access to this data. And they say it's been a hindrance that they haven't had full access to this data so far. And they say that if they can get this information, it will allow them to study the spread of the virus and potentially prevent it as well. So they're really appealing for urgent access to the Prime Minister to be able to get hold of that information and properly study the spread of the virus.
All right, many thanks for that, Rebecca Bunnan, speaking to us from Mumbai.